Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Stephen Zonner. Dr. Zonner earned his medical degree at Midwestern University before completing his family medicine residency at Bodsford General Hospital. He completed his fellowship at Rush Presbyterian St. Luke's Medical Center. Dr. Zonner is board certified with the American Osteopathic Association. He is also a member of the Washington Township Medical Foundation.
I think you'll find this enjoyable. Exercise is not something that we, think about jumping out of bed in the morning. It's something that really, it's a habit that has to be learned. And one of the things I hope you'll learn from the talk tonight is that exercise as medicine, exercise is medicine. And the more and the longer I practice, the more I realize this. In my sports medicine practice, we take care of athletes with concussion. We take care of athletes with other injuries, and we know that movement is good. It's better for your body. We've gone away from immobilization. If you have a joint that's arthritic and it can move a little bit, the more you can move it, the better. It sometimes seems counterintuitive, but movement is good for your body. And we'll talk more about what kind of movement as we go along tonight. And I think many people have seen this woman in the cartoon. I forgot her name. But she's saying here, as this woman is sitting on an exercise bicycle with, looks like her dog is doing jump rope, she says, "I've got to start taking better care of myself. Whoever was supposed to be doing it has done a really crappy job." I like that one. So we have to take responsibility is the message on that slide. We've all grown up in that era when we talked about smoking and how bad smoking was. Well, I'm here to tell you tonight, sitting is the new smoking. Sitting in front of your TV is deadly, and let's talk about it. What happens when you sit? You have a 2 times greater risk of developing diabetes. Well, I would imagine most of you are here tonight because you've had diabetes, so we know, or your doctor and the nutritionists and the other professionals like Vida have talked to you, why exercise is important. It helps lower your blood sugar. So it stands to reason that if you don't exercise, you're not only going to put yourself at risk for diabetes, but if you already have it, you're not going to control your sugar as well. So moving around is very important. You have a 90% greater risk of cardiovascular disease. And last, a 49% greater risk of all-cause mortality. So a 50% increased risk in death just from not exercising, from not moving around, if you just remain sedentary. The good news is, if you start moving and get up, that risk starts to go down right away. So it's not something that you think, well, I haven't done it for so long and I'm just in such bad shape I can't do anything. What you have to do is you have to start to look and think out of the box. And that means looking at what you have available to you as resources. If you can move your arms, but you can't move your legs, you can exercise. You're moving your arms. You can imagine you can do flapping motions, you can pretend you're swimming. You can do things moving your arms around. So again, it does require a little creativity and a lot of willpower. I love this meme. So there's a doctor with a model of the heart talking to the patient, and he says, "So you see, you have 2 choices. We could perform triple bypass surgery, where we take a vein out of your thigh and open up your chest so we can sew the vein onto your coronary artery. This costs more than $100,000 and will keep you laid up for at least 2 months. Or we could put you on a vegan diet. Gee, doc, a vegan diet? That sounds pretty extreme. I think a lot of us think like that, right? The prevention part just sounds too easy. It just sounds ridiculous. So why don't we just keep going and, through the miracle of medicine, make ourselves better? Well, obviously, that's an extreme that we don't want to go to, because with diabetes, we know, a lot of us know already, what the outcome can be of not controlling your diabetes. So I like to put to my patients an alternative. I said, if I could give you a pill, right? And now people perk up. If there's a pill that would give you more energy, make you smarter, actually increase your brain power, help you sleep better, lower your blood pressure, prevent diabetes or lower your sugar, raise your good cholesterol, the HDL, and lower the LDL, the bad cholesterol, prevent osteoporosis, weakening of the bone, improve your immunity, enhance your libido if you still have it, guess what? That pill doesn't exist. It's a trick, right? It's exercise. And I know we know that our beloved pharmaceutical companies would love to find that miracle drug. It would be wonderful. But the reality is, it is in your hand. The answer to helping yourself is in your hands. And we also happen to live, as I don't have to point out very strongly, in a very beautiful area where the weather cooperates most of the time. So we really don't have too much of an excuse for going outside. If you can't go outside, then definitely there's things that can be done indoors. Now, there's many, many medical journal articles. I've got one here, I think it came out in July. Time Incorporated put in a nice little article, little booklet on the science of exercise. Younger, smarter, stronger, they talk about. Well, the reality is this can happen to anybody at any age. Exercise works for all ages. At least 75% of people age greater than 65 do not exercise at the recommended levels. That's a lot of us, right? A lot of us over age 65 are just not doing it. This the lack of motivation. My own mother, trying to get her motivated. She went to a physical therapist who evaluated her because she's 84, she's getting unsteady. And now to get her to go independent is another challenge. It's just, we get stuck in habits, or we have other responsibilities and things that I got bills to pay, I've got this and that. These exercise benefits, as the slide says, can begin when you begin even at age 75 or later. The best part of exercise is aerobic. There's anaerobic and aerobic. Aerobic exercise is exercise that's sustained and lasts longer than 10 minutes. So that means you're out walking at a pace, let's say, that is brisk enough to make it difficult for you to hold a conversation. And you get a little sweat. That's aerobic. Another way to put it, and I've heard people say this when I mention it to them, they said, I never thought about it that way. It's the first 5 minutes of exercise always is hard. It's difficult. That's because it's the anaerobic part. That's when you're burning sugar. But if you want to burn fat and you really want to get all those benefits that we talked about in a previous slide, hang in there for those first 5 minutes, and then all of a sudden you get to that point where I can do this. It's amazing. It's like a switch goes off, and then you can maintain that pace. So it's always hard the first 5 minutes. You can't give up after the first minute. You have to sustain it. So make sure that whatever exercise routine you do, that you don't kill yourself. You want to do an exercise pace that's up to the point where your breathing is labored, but not to the point where you're huffing and puffing and gasping for air. Right? We want it so that if you're trying to have a conversation with somebody, it would be in short word sentences. You would talk very slowly. That's about a good way of measuring it. We can get into heart rate and all that, but I find it's much easier for people to grasp if you just think about it that way. And that may not be very much for you to get winded, but that's important, right? Because you don't want to go out and suffer. So we know, what does exercise do? It is known it will slow and even prevent dementia and Parkinson's disease. I have an athlete of mine, this is now in a different age group, But this young man had a bad concussion, and it's one of those concussions that it's unfortunate. I can't explain why it's like this, but the only way he can remember to do his arithmetic, he's in high school, or his algebra, is if he exercises. If he doesn't exercise, he can't think. So this kid is, fortunately or unfortunately, forced to exercise the rest of his life so that he can function better. But we know exercise lowers your blood pressure, makes the muscles more supple, makes the arteries more distensible. Big one, alleviate depression. If you go just walking outside on a beautiful night or a beautiful day is enough to help that. But the actual aerobic benefit of exercise really will make you happy. Preventing osteoarthritis. So joints, we know, will get stiff if you don't use them. If I was to do a little experiment with you all here and take everybody's arm and elbow and put it in a cast for 2 weeks, and just for no reason, just for the experiment, and I say, come on back and we'll take you out of the cast in 2 weeks, I think everyone here would understand that that elbow would feel what? Stiff, right? Sore. And boy, when you would take it out of that cast, the first thing you'd do is you'd move it, wouldn't you? You'd move it around. And there's a reason, scientifically, why that works, but basically the joint surfaces, the only way they're getting their nutrition is through movement, passive motion. So that gets back to, well, what if I have arthritis? I can't exercise because I have arthritis. The reality is, unless your arthritis is so advanced, where you're that bad, where you may need a joint replacement, you can actually help modulate and control your arthritis by getting the muscles and everything surrounding it stronger. Prevent osteoporosis, we talked about. Weighted exercise, walking or jogging, those types of things actually impact the bone and make it stronger. Swimming and bicycling, supposedly, it's true, are not as good in terms of bone stock, but you still have the effect of exercise with the muscles pulling on the bones. Brain atrophy. Atrophy means shrinking. A recent study came out that showed that people that exercised intensely when they're in their 20s and continue it to some degree in their middle age maintain the size of their brain. People that don't, if we were to x-ray or get a CAT scan or MRI of the brains of people that don't exercise, the brain shrinks to half the size. It's remarkable. So I think we all, I could probably speak to personally, the forgetfulness that starts to happen in your 50s and maybe can accelerate in your 60s. But I just want to say, from a personal experience and dealing with athletes and people who are active, their brains become sharper. Your brain will become sharper with exercise. I love this slide called Odd News, not fake news, this is odd news. And this is a 101-year-old man who started running marathons at the age 90. That takes some kind of gumption. That man must have had either incredible bone stock or mental will. But again, it shows you don't have to go out and run a marathon 26 miles, but you can start somewhere. Anybody can do it at any age, I think. Aerobics. I think most of us have remembered the 70s when all of a sudden, right, you saw people running on the road and people having aerobics classes and dancing to music in these classes. And so aerobics came about because of a doctor named Kenneth Cooper. It's still around, it exists, the Cooper's Aerobic Institute, in 1970. This slide is meant to show you how our muscles work, the skeletal muscle. Skeletal muscle is the fourth largest organ system in the body. We've got the nervous system, which is just millions of miles of interconnectivity. We've got the vascular system, but the musculoskeletal system, bone and muscle, is huge. Obviously, it's important for movement, posture, breathing, and we get into something that we won't go into tonight, but we call your aerobic capacity. And your aerobic capacity is based on your ability for your body to use oxygen. That's basically what that means. So we all know we need oxygen to live. There's actually little organs inside our cells called mitochondria, and mitochondria are what help turn oxygen and sugar into energy. The more you exercise aerobically, the more mitochondria you have in your entire body. And the more mitochondria means you're using oxygen more efficiently. And when you use oxygen more efficiently, all your systems work well. Your brain, your intestines, your heart, everything. Muscle is a secretory organ. Secretory means that there's substances that come out of the muscle that are good for you. It's almost like you're walking around, you've got a pharmacy inside your muscles. They're called myokines, but muscle contraction, just walking, will release these products. Now, what are the types of exercise? As we alluded to before, there's this anaerobic phase, which is that first phase when you get started. And you may have heard of lactic acid. Lactic acid is the thing that makes you just so tired. It builds up, and that acid in your muscle just makes you just really fatigued. But if you keep going, and you don't go too fast, right? You keep at a pace that you can sustain, you can get into the aerobic phase. And the aerobic phase is when you burn fat. And when you burn fat, your blood gets a little acidic, but in a good way, called ketosis. And that ketosis does wonderful things for your brain and your body. That little bit of acidity. What are the organ-specific effects? I mean, what parts of the body how are they affected by exercise? Neurobiologic, meaning the brain, we call neuroplasticity. The brain is plastic, right? Figuratively, it's a medical term. But what we mean by plasticity is that we've found now that the brain, we used to think, right, the brain dies at a certain age, you're losing brain cells, you don't make more brain cells. Wrong. Aerobic exercise helps the brain regenerate, and it helps it form new dendrites, which are new connections in the brain. Been proven. One of the factors, these neurotrophic factors, big term, BDNF. If you're so inclined to Google that, BDNF, brain-derived neurotrophic factor, that is what is released with aerobic exercise in the brain, and that's what prevents dementia. That's what helps our athletes recover from concussions faster. We used to think that you didn't want an athlete to exercise if they had any symptoms. And we know now that the symptoms are more telling us that the body's saying it needs something to be done. And so when we have people exercise now, we're seeing concussions now resolving twice as fast. Exercise goes along with mood and sleep. I talked about that, right? Elevates your mood. And it does it through these various byproducts. You may have heard of something called endorphin. Endorphins are your own body's morphine. Your body makes its own painkiller. And if anybody has gotten to that point in an exercise routine where afterwards you have this little high, you're feeling really good, or you can get it from a stretch. Stretching releases endorphins. If you stretch, it hurts for a little bit when you do it, but then you let go, you get that feeling. Those are endorphins. Those are great. Those elevate your mood, lower your blood pressure, and they're free. You don't have to go to the pharmacy. They're right there in your body. The heart, obviously a very important organ for us. What exercise does is it increases your endurance. I would like to say right now that if you had a choice between weight training and aerobic, meaning walking or running or swimming or something, I would recommend aerobic because of that factor we talked about with the brain. I would love to have my brain be smarter, right, and sharper and be able to remember things more than I would have a bigger muscle. So that's my own feeling on it, but I think you'll find that you need a little bit of both, but it's still, I would choose aerobic. But what exercise does, it actually reduces inflammation. And inflammation, we may or may not know, is the basis of all disease. But you can't live life without inflammation, right? Because inflammation helps us heal. Inflammation comes to us in many different forms, most often in diet. And we eat foods that cause inflammation. So we have to counteract those effects with better diet. Eating your blueberries, taking your vitamins, your omega-3 fatty acids. But exercise is not a food. It's there for you. It helps reduce inflammation. SOD is superoxide dismutase. Big name. But basically, it is there. It has been proven, and it shows that the body is releasing these chemicals that actually help. Catecholamines are the stress hormones, and insulin, as we all know, is from diabetes, is the important hormone for regulating sugar. And if you're a type 2 diabetic, it means you're producing plenty of insulin, but it's not working. And that insulin, that's called resistant. So if you want to make your insulin work better for you, by exercising, it makes the muscles more able to absorb insulin and sugar. So again, something very important. And it also then helps reduce your stress by fighting the catecholamines. Blood pressure, as we mentioned, lowered. I won't go into pulse wave velocity right now, but that's a very interesting new tool we have to measure how elastic the arteries are. Other organ-specific effects are gastrointestinal. You want to prevent constipation. A lot of us, as we get older, constipation becomes an issue. It can be because of medicines. But exercise helps the motility of your bowels, right? Many of us, after a big meal, will go out and walk the dog or go walk around the block because we know intuitively that makes our stomach feel better, it makes our intestines feel better. Well, you can also improve your bowel movements. You can improve the blood flow to your intestines. That's the celiac and splanchnic. And decreasing transit time means the fecal material, the excrement, moves faster, the poop moves faster through your bowels if you exercise. And that is good because what it does is it decreases, if you have anything nasty in there that could cause cancer, you're decreasing the amount of time that it's in contact with the wall of the intestine. So the more you exercise, the faster things move, and it's better for your intestines in preventing cancer. You also release a lot of these other chemicals again that help your immune system. And there is no effect on liver function, which is good to know. I mean, but if you have a fatty liver, which is another subject in itself, obviously you can help burn the fat up with exercise, aerobic exercise. It also decreases the lower esophageal sphincter tone, so you improve if you have reflux can be improved with exercise. Does exercise prevent cancer? Yes, it does. 13 types, it's been proven. Primarily breast, colon, and lung cancer. So it's interesting, those 3 types of cancer, obviously there's many different types of breast and different types of colon and different types of lung, but of the types that are susceptible to prevention by exercise, they're also susceptible to diet changes. Again, it gets back to that whole thing of inflammation. So when you exercise, you lower your inflammation. When you eat better, you lower your inflammation, you can reduce your risks for those things. Or if you already happen to have those or in an early stage, exercise helps you. It increases your immunity. There's other liver, esophageal, kidney, stomach cancers that can be helped by it. Endometrium would be the uterus, blood, leukemia, bone marrow, those can be helped. Head and neck, rectal, bladder cancers. However, it's interesting because I think they say that the reason you might have an increased risk in melanoma from exercise is because probably people exercising outdoors. I think that's the relationship there. Prostate, I think they did that in bicyclists, and there may be some relationship between sitting on a bike and having some effect on the prostate. But that's the end of my talk tonight, and I want you to remember that exercise is good medicine. Thank you.